Okay, so our presentation is about cerebral palsy, and it's by me, Leanne, April, and Sophia. First things first, we're going to start off the pathophysiology of cerebral palsy. So, cerebral palsy is a group of permanent movement and posture disorders caused by non progressive disturbances in the developing fetal or infant brain. The pathophysiology of cerebral palsy involves damage to specific areas of the brain that control motor function occurring before, during, or shortly after birth. Cerebral palsy results from early brain damage, primarily affecting motor control centers, with the specific manifestations depending on the timing, location, and extent of the injury. Though the brain injury is non progressive, the physical impairments may change as the child grows.
So the types are spastic cerebral palsy, and the causes are damage to the motor cortex or pyramidal tracts. And then there's the ataxic cerebral palsy, which is damage to the cerebellum, dyskinetic, which is damage to the basal ganglia, and then mixed cerebral palsy, which is multiple areas of the brain are affected.
For medications, we have tizanidine, which is a muscle relaxant that reduces muscle spasms and rigidity. Side effects include dizziness, sedation, fainting, bradycardia. We also have baclofen that also relaxes the muscles by reducing muscle tone and improving mobility. Side effects are nausea, confusion, hypotension, seizures, and constipation. We also have topiramate used to treat epilepsy, seizures, tonic-clonic seizures, and prevents migraines. Also, side effects are drowsiness, fatigue, paresthesia, weight loss, blurred vision, and levetiracetam, primarily used for patients with cerebral palsy to manage seizures and slow electrical impulses to brain. Side effects include irritability, depression, headaches, and unsteady gait. For nursing interventions, we have therapeutic communication. Using simple, clear language, involve the child in the care treatment, establish trust and safety, use visual aids when communicating. Prevention of injury include maintaining a safe environment, seizure precaution, prevent musculoskeletal injury, prevent aspiration and choking. Education to the patient and the family, including education of child-specific cerebral palsy type and prognosis, offer emotional support, encourage routine and consistency, culturally sensitive care as well, and overall medical needs include medication administration and monitoring, seizure management, dietary needs, and mobility and respiratory care.
Okay, so a little bit about the patient teaching for children with cerebral palsy. What to know: your child will need help with walking, talking, eating, learning. Every child with cerebral palsy is different. Some may need more support than others, just depending on the severity of their diagnosis. Ways that you can go ahead and help your child include therapies, medications, equipment, nutrition. A little bit about the therapies would be those who perform physical therapy, occupational speech therapy to help with movement and communication. Equipment would include braces, walkers, wheelchairs, just to help the child go ahead and improve their mobility throughout their growth years. Nutrition, you just want to always make sure that the child has a healthy diet. Some kids are going to need feeding support, some may not, some may progress, better, and some may actually experience um, more delayed learning, well, just like learning how to do things for their own. Some of the support that you can provide is to stay in touch with your child's healthcare team. Just make sure that you're updating and just having any questions that you have regarding the disease itself. Just feel free to go ahead and contact your child's healthcare team to just maybe even get, new tips and tricks to go ahead and better assist your child. You're going to ask about the special education and early intervention programs. So it's very imperative that with children with cerebral palsy that you start early. So then that way too, during their growth years, they just progress and not regress. Some of the support groups and counselors, they can help the child cope emotionally, especially after seeing those other children, just throughout their life cycle, just better be able to cope with the fact that they're not going to maybe be able to do some of the things other children can't do, and just better assist them emotionally and physically. So, in conclusion, as a reminder, cerebral palsy is a movement disorder that happens because of damage to the brain before or during birth. It does make it hard for children to control their muscles, so they might have trouble walking, talking, and doing, other activities, whether it's physically, interactively. It usually is caused by a problem during brain development and not getting enough oxygen to the brain or genetic condition. Um, Cerebral palsy can affect different parts of the body and can vary from person to person. So, not all child diagnosed with cerebral palsy will be the same. Every child's case is different. Some people may have trouble with their legs, others might have trouble with their hands and their arms, and some children may have problems altogether in all areas. So, it's just very imperative that you make sure that you get the right help. You recognize the child's needs mentally and physically early, so that way too during their imperative growth development, they continue to get the help that they need, and then that way, instead of again regressing, they progress. And that is it. Thank you.